I'm taking a deep dive into hypnosis for hot flashes. A lot of the time when I tell people that hot flashes can be improved with hypnosis, I get one of two responses. Either the person looks at me completely blankly, like that, or they get a very, very scared, frightened, and skeptical look of disbelief. And honestly, it makes sense. There's so many misconceptions and myths about hypnosis. If you're a person of faith, you might have learned that hypnosis is evil or mind control. And if you're a doctor, physician, or other healthcare professional, you might have brushed it off as pseudoscience or just some sort of woo-woo thing. But there's real science behind hypnosis. There's actual evidence-based reasoning behind the use of hypnosis for hot flashes. And that's what I'm about to break down in this video. So if you're someone who's looking for a safe and natural way to get rid of those hot flashes once and for all, and you're curious about hypnosis, then this video is for you. And if you're a healthcare professional who wants to see the evidence and wants to understand the mechanism of actions behind hypnosis for hot flashes, then this video is for you too. I got you. So let's jump in. Now, as a doctor learning about a new treatment or therapy for an illness, I've always been a little annoyed when people have these long, drawn-out scientific explanations with charts and data, to explain a treatment and an illness. I don't need the entire history of World War II, infected soldiers to understand how penicillin works in the body and how it works to treat infection. Don't give me the entire thing. I need the down and dirty. And so that's what I want to do here today with hypnosis and how it works in the body to treat hot flashes. So firstly, I'd like to explain what a hot flash is. When women are in perimenopause and menopause, perimenopause being the time period before you go through the menopausal transition, and menopause being the time when your menstrual cycles cease. Both of these, perimenopause and menopause, occur with changes and fluctuations in the hormone estrogen. In perimenopause, estrogen goes up and down and around and all over the place. In menopause, we see a deep drop of the estrogen levels all the way down. And when estrogen levels drop down, we see a lot of symptoms. Namely hot flashes. Hot flashes are one of the most common types of symptoms that we see in perimenopause and menopause. The reason hot flashes occur is because estrogen, the hormone that drops down so low, is very critical to so many parts of our body. And one of the main things that it controls is the temperature regulation systems in our brain. So in the hypothalamus, which is an area inside of the brain, is where our thermoregulatory system sits, or our basically thermostat temperature control system in the brain. That's where it lives. And estrogen is very involved in this thermostat. So when estrogen levels go low, body's thermostat gets very sensitive. So very slight changes in temperature can cause the thermostat to falsely tell your body to cool itself off, even if it's not actually that hot, right? And so what happens is this cooling system is activated with slight temperature changes, and we see even slightly stressful situations can trigger the cooling system. Cooling systems tell your body to increase your heart rate, which increases the blood flow to your extremities, that will increase your sweating activation systems to go off. And that's where we see palpitations, we see heart rate go up, and then you start sweating and feel very hot. And that causes your body to cool you off. And that's how a hot flash works. Now, the treatments for hot flashes include hormone therapy, antidepressants, a medication called fezolinetant, and this is a neurokinin 3 receptor blocker, certain supplements, a procedure called stellate ganglion block, and one of my favorites, hypnosis. A common theme here is that these all work on the brain chemistry. We don't fully understand the exact mechanism of how hypnosis works to decrease the frequency and severity of hot flashes, but by understanding the different levels of the mind and how the mind works, understanding the different types of brain waves, and understanding some key hormones and brain chemicals, a little neuroendocrinology. These three elements help to explain how hypnosis works for hot flashes. There are three levels of the mind. The conscious mind, that's the mind that thinks, that has our executive function, that has the to-do list, all of the things that I'm saying and you're hearing, that is all happening with your conscious mind. Then there's the subconscious mind, and this is the part of the mind that processes our emotions, holds on to our memories, and is sort of like the rules and regulations, the operating system of how you see yourself in the world, how you perceive the world, your beliefs about the world. And that is the area of the subconscious mind. And then there's the unconscious mind, and the unconscious mind is the same thing as your autonomic nervous system. So the unconscious mind is for rest and repair, and it also controls the functions in our body that happen naturally. So I always give the example of if you had a bowl of soup, taking the spoon is your conscious mind, and then in the unconscious mind or your autonomic nervous system, once you swallow that soup, it goes into your stomach. Your stomach begins to digest it, releasing the necessary enzymes and hormones to break down the soup in your stomach and send the carbohydrates to where they need to go, and the fats to where they need to go, and the protein to where it needs to go. All of this is happening underneath the surface without you thinking about it, automatically by your autonomic nervous system and your unconscious mind. So remember this for later, but the area of the mind where hypnosis works is the level of the subconscious mind. So let's talk a little bit about brain waves. Our brains operate in different rhythms. Beta brainwave is the busy problem-solving state. So this is your everyday busy thinking brain. Kind of goes along with the conscious mind. Keep that in mind as we move forward. So the next two types of waves are the alpha and theta brain waves. These are calmer, more relaxed brain waves. So in the alpha, we've got calm, relaxed, creative focus, very much relaxed and calm. The theta brain waves are the twilight zone between wakefulness and sleep. And in this time period, in this brain wave, you are a lot more relaxed, very deeply relaxed. And this is often linked to our subconscious mind. So what we see is in hypnosis, where we're getting to that relaxed state of mind and we're getting to the subconscious state of mind, a lot of the brain waves that we see during hypnosis are either alpha, and then when we're in hypnotic state, we tend to be in that deeper theta twilight zone brainwave. Delta is a brainwave of sleep and repair. So in delta, we're in that unconscious state, so where the autonomic nervous system is doing its work, you're asleep, you're getting repair of the body, and this state is where often when we're sleeping, we actually have hormonal production taking place, like testosterone is a good example of this, where that production of testosterone by the autonomic nervous system in your sleep, in your unconscious state. So we can kind of see here again where these different brain waves correspond with the different levels of the mind. Beta, conscious mind, alpha and theta, subconscious mind, and then we've got delta with the unconscious mind. So you're starting to see how this makes sense, right? There are a number of studies that show changes in our brain chemistry in the neuroendocrinology after the use of hypnosis. In this study, we saw a rise in growth hormone, prolactin, and aldosterone. In this study, we saw changes in cortisol and oxytocin. In this study, we saw arthritic patients have an increase in beta endorphin-like immunoreactivity after hypnosis. So again, that neuroendocrine something going on. Now, granted, this study wasn't a robust study, and the sample size was small, but it still demonstrates, the potential connection with hypnosis and release of these neuroendocrine factors. So what is hypnosis? Hypnosis is a state of relaxed, focused awareness, and it's used to remodel the subconscious mind. It works by relaxing the mind and getting it to a level of very focused awareness in order to access the subconscious mind and remodel it. It seems that the relaxed state that hypnosis puts you into and communicates with that subconscious part of the mind is causing some sort of interaction with the unconscious mind, so that we're now resetting the temperature regulation system in the brain, whether that is a neuroendocrine release, whether that is, increasing production of native hormones in the body. It's not completely clear how it works, but we do know that it works, and there are studies that actually support that. In 2011, Elkins et al. Came out with the research study Hypnosis for Hot Flashes Among Breast Cancer Survivors. And this was a small pilot study that found 68 to 70% reduction in hot flash scores, while also improving sleep quality, anxiety, and depression. Following this study, Elkins et al. In 2013 came out with a study, Clinical Hypnosis in the Treatment of Postmenopausal Hot Flashes. This is a randomized controlled study with 187 participants that showed dramatic results, where hypnosis led to approximately 74% reduction in self-reported hot flashes versus 17% in controls. And there was a 57% reduction in the physiologically measured flashes at 12-week mark. In 2013, there was a randomized controlled trial comparing hypnotherapy to gabapentin, the medication gabapentin, also a neuroendocrine factor, for the treatment of hot flashes in breast cancer survivors. And this was also a pilot study. And this study showed women undergoing hypnotherapy reported a 68% reduction in hot flash severity and improved quality of life measures. This year, 2025, there was a study comparing clinical hypnosis versus cognitive behavioral therapy. And this review found that hypnosis outperforms cognitive behavioral therapy in clinically significant reductions in hot flash severity and frequency. So there are a number of studies that have looked at hypnosis for hot flashes, and it does provide some benefit, and with very minimal risk. This is an option that more clinicians should be looking to help our patients who are not necessarily candidates for hormone therapy, but still, or if they just want a natural option without pharmaceuticals. This is a great option to consider for use, and not only having benefits for hot flashes, but also having benefits for overall well-being, managing and navigating the menopausal transition. There are some really good studies on meditation that do show some correlation between some of the biochemical endocrine factors in our blood. Meditation is also something that will put you in the alpha states, mostly alpha, but sometimes theta states as well, which is the same brainwave states that we see in hypnosis. And so it follows that the neurochemical pathway of how hypnosis gets us to cooler hot flashes, it might operate on a similar mechanism of action. There was a study on meditation and stress response that found that compassion meditation buffered cortisol responses and improved immune reactivity in response to stress. This study done in 2023 shows that aerobic exercise, slow, deep breathing, and mindfulness meditation improve cortisol and glucose in women with type 2 diabetes. So I am making a stretch. These aren't studies on hypnosis, but this is my thought on how hypnosis helps with hot flashes is somehow mediated by some neuroendocrine process. We're going to see the release of brain chemicals, whatever those are, that will end up augmenting and changing the brain chemistry in a way that helps the thermoregulatory system in the brain to get back to where it's supposed to be. So repeatedly we see effects of meditation, which again is in those alpha brainwave states and sometimes theta brainwave states. We're seeing reductions in cortisol. We're seeing improvement in immune neuroendocrine factors and benefits to disease-specific benefits like with type 2 diabetes, as well as some broader neurologic benefits. So again, it stands to reason that hypnosis most likely works on the same type of axis. The other thing that I'll point out is that many of the other treatments that we use to treat hot flashes work with some sort of brain chemistry. So we're seeing the antidepressant medications, which work in the synapses with the selective serotonin reuptake inhibitor. So we're seeing that happening in the nerve cells. We're also seeing that with the medication fezolinetant, because fezolinetant is a neurokinin 3 receptor antagonist or blocker, and those neurokinin 3 receptors are found in the brain's hypothalamus. So in that hypothalamus, again, is the area of the temperature regulation. So again, we're doing all of these things in the brain, neurochemistry, neuroendocrinology. So, it stands to reason that the hypnosis is working in the same way. The other treatment that I mentioned for hot flashes was the stellate ganglion block. And so this is a block of a set of nerves that lead to the brain. So again, we're talking about nerve intervention, brain intervention. So I believe that hypnosis works in some similar way to change the brain chemistry and help us to cool down those hot flashes. So if you have any doubt, if you have any skepticism remaining, do you feel less suspicious of hypnosis? I'd love to hear what your thoughts are on this. If you're interested in using hypnosis for hot flashes, do you have a better understanding of it? If you're a healthcare professional, is it something that you would recommend to your patients? I'd love to hear your thoughts. If you are someone suffering from hot flashes, are you more interested in using hypnosis for hot flashes? I'd love to hear. Drop a comment. Feel free to reach out if you have any questions. Thanks for watching, and I'll see you next time.